I know we've discussed the Change Healthcare incident before. Now we've had a few months to kind of digest what happened. How would you assess the impact of that incident on the healthcare industry?
I think the impact is an opportunity. Clearly, more than a third of the healthcare market was affected in somewhat catastrophic ways. But what are the lessons learned from that? And it was coincidentally a couple of months later that the White House released its national security memorandum that directed all of the federal agencies with responsibility over critical infrastructure sectors to do a risk mapping of your sector. Understand, how does it work? What is the process flow from the beginning of a transaction to the end? In our case, healthcare. Somebody goes in for an MRI and that information has to be evaluated, and then it goes to your payer, and maybe there's a prescription that comes out of that. What are all the stops along the way? And one of those stops is Change Healthcare. So we are embarking in the Health Sector Coordinating Council, along with the government, on a risk mapping project to, what I like to say, is rip up the floorboards and look at the plumbing. The plumbing for the healthcare system. Where are the leaks? Where are the loose joints? And then we can assign risk to some of those critical services, critical utilities that are vulnerable to significant disruption, either because they are low redundancy, no redundancy, they are based geographically in countries that may be unstable or not friendly to the United States, and build a risk management plan around that. So that's the takeaway for me for the Change Healthcare, is it really is a forcing function that we need to be better prepared. We're not going to be able to stop these attacks always from happening, but we can at least anticipate where some of our weakest points are and build in some redundancy, some kind of backup, some kind of provision for that for that scale of disruption.
Right. Because, I mean, the attack itself wasn't necessarily unique, but just hitting that kind of center hub of this all these spokes that kind of shot out from Change Healthcare, I would imagine it was a pretty big wake-up call for other soft spots that are in the industry, I would imagine.
Oh, absolutely. And so what we're going to be doing is, if you put it out on a schematic, and you've got you've got a circle and a square and a triangle and a rectangle, and inside each one of those is a function like the payer or the doctor and the prescriber and the pharmacy. But what happens in between those is maybe a software program, or maybe it's a communications platform. And we need to know who's providing those services to us as part of your business impact analysis, as part of your supply chain, third-party risk management analysis. So we have a lot of work to do, and that's done at an enterprise level all the time. But how do we scale out that mapping at a national level to really see those interdependencies, interconnections across a healthcare system that is complex? It's not just the health providers, it's the medical device companies, it's the pharmaceuticals, it's the payers, it's the health IT companies. So it's a large but essential project.
Massive undertaking.
Yes, it is. And we did this, and by the way, I came from the financial services sector several years ago, and we did this well ahead of this. This is more than 10 years ago. Imagine a piece of paper that's about 5 feet tall and 12 feet long. That was the result of the financial services sector mapping. We literally taped it up on a wall. It was outsourced by the Treasury Department to a consulting firm to look at all of those critical nodes. And it was mind-boggling, but at least it gave us a visualization of where all of our potential vulnerabilities, our soft spots are, as you termed it.
That's wild. I hope that thing exists somewhere still.
It does, and it's by now probably a classified document. That's
Sure.
not the kind of thing that you want the adversaries to get a hold of.
Right. In terms of whether it's an organization like yours or CISA or somewhere else in the government, what should be done to communicate more urgency to healthcare cybersecurity leaders within hospitals, within organizations like Change Healthcare?
That's such a great question, and that's really one of our biggest challenges. It is, in our sector coordinating council, we have published 27 best practices documents by the sector, for the sector. Now it's a matter of not just leading the horse to water, but getting the horse to drink. And how do we do that? Well, fundamentally, it's at its base a marketing exercise, but it's ultimately a culture change. And how do we leverage our resources to effect that culture change? It is the government using its bully pulpit, but also the government using incentives. So the C-suite in these organizations are thinking, how can I reduce costs? How can I increase efficiency? Cyber regulations, well, that's another cost. I understand the reason why, but we need to be thinking creatively about how to motivate the business leaders across the country, and to do that also from the top down. And for healthcare, one of our rallying cries, our essential imperatives is cyber safety is patient safety. So if we can drill it down to that level of existential detail, I'm lying on the hospital bed and suddenly the medical device that I'm hooked up to is turned into a brick by a cyber attack. Mm-hmm. Well, that offs the patient, doesn't it? So if we can bring that level of palpable impact on the human being, I hope that will be motivating. And it's a matter of time and years and using the senior executives, the market movers, the market influencers in the industry to say, yeah, we're in. Right. And everyone else ought to be too.
You mentioned marketing. That's a simple, powerful message. Cyber safety is patient safety.
Yeah.
Just curious, what's your level of optimism about the current regulatory environment in healthcare, cybersecurity?
I think we are at a point of balance right now. We've been told we should expect more minimum baseline cybersecurity regulations for health systems to be held accountable to, the so-called cyber performance goals promulgated by Health and Human Services. For now, they are voluntary. We're hearing they're going to be mandatory at some point. And I think those are appropriate because they're mostly outcome based. The most important thing government can do if it is going to regulate is to regulate certain outcomes. Tell us what, but don't tell us how. Because if you tell us how, the methods will change over time. We hear, well, there's multi-factor authentication. Well, maybe one day there's not going to be such a thing as multi-factor authentication because there's going to be, AI that's going to be managing identities and access. So we have to have a regulatory structure that is flexible and resilient. But then going back to the marketing and how do we get a change of culture, that's got to be something. The how part has to be, an all hands on deck imperative among the nation's leaders to say, okay, here are the outcomes. I'm responsible for these outcomes. Let's do this the best way we can, the optimal way. Yeah. The most security is not necessarily the best security. Right. It's the optimal security you got to shoot for.
Where do hospitals, health HDOs, where do they need the most cybersecurity help? Like some easy wins. Is it a resource question? Is it technology? Is it cultural? All of the above, I'm sure.
Great question. We actually have, let's focus on what we call the smalls. The small, rural, critical access, under-resourced health systems who, referring back to the cyber performance goals, if those become mandatory on them, well, that could be another, that last straw on the camel's back. And so we ask the government, okay, you're going to give them a new mandate. What government are you giving in return? How are you going to help them be in compliance? We actually have a task group in the Sector Coordinating Council for underserved providers, and we are interviewing dozens of senior executives of those smalls geographically all over the country, asking them, how do you equate cybersecurity with patient safety? Do you know what kinds of controls you are implementing? And by the way, if the government's going to regulate you, what's going to be meaningful in terms of government support? Is it grants? Is it subsidies? Is it incentives, technical support, training? The answers are coming back now, and it's surprising that a lot of them are saying, we know what to do. You know, we know there's a lot of resources there. We don't have the people to do it. So does that mean training? Not necessarily training. If you translate it, it probably means more grant money, either more grant money so that they can build their workforce or at least bring people in on a part-time basis to implement these controls, or do some kind of a program that engages sort of a cyber core of volunteers, cybersecurity experts, either within the community or the healthcare community, or among the many cybersecurity consultancy firms that are out there that want to help and leverage their expertise through some kind of a cyber corps, Peace Corps kind of a analogy. Those are the kinds of things that I think would be meaningful and helpful to them, and money is a big part of it, and education.
Right. I mean, some of the problems don't sound too different from some of the other critical infrastructure sectors, like water. A lot of small water utilities across the country. No time, no people, no money, and probably the same dynamic for hospitals.
Well, absolutely. And I came from financial services before. You wouldn't think of, the financial services sector, all that money. No, there are thousands of small community banks across the country that they have maybe 2 branches in their county. And the HR person is doubling as the IT person. It's the same thing. And they're operating on a very thin margin as a small community bank. Same issue for us and for them in financial services. You have the under-resourced banking providers that they needed our help, and they were the weak link in this vast interconnected financial services ecosystem. The same thing holds for healthcare. You mentioned water, small electricity substations in a rural area. It's endemic.
So just a quick question about threats. Obviously, ransomware is just kind of running amok in healthcare, has been for a while. Is ransomware cyber for healthcare right now? Are they leaving themselves exposed to other threats? Like, is that the conversation when it comes to cybersecurity? Is it ransomware?
For now, it is ransomware.
And with good reason, I'm sure.
And with good reason, because it is, I've been doing this for more than 20 years and seeing sort of the evolution of desires and motivations among the hackers, and there was desire for disruption and for identities, but now this is for healthcare. This is easy money. If you're a hospital system that has been ransomed, and you have 2 choices: you pay the ransom, and you continue to care for patients, and you suffer a huge loss, or you don't pay the ransom and suffer the risk of going out of business and no longer being able to care for patients. For most, that's a no-brainer, unfortunately. So, for now, I mean, I remember years ago we kept talking about APT, advanced persistent threats. What are we going to do about advanced persistent threats? And that's nation states who are getting into our networks and just sitting there and waiting for the right time. This is much more existential for the healthcare industry. That cyber safety is patient safety. Cyber insecurity is patient insecurity. So that's what we're focused on. That's what we're focused on now. But ransomware is just one more manifestation of different methods of getting into a system. Right. You can get into the system and you can either do a ransomware attack, or you can just wholesale steal the data, or you can corrupt the data. It just depends on the motivation of the hacker, but in this case, the motivation is money. Money is king.
All right, so as a last question, last thought, you mentioned the CPGs maybe becoming mandatory. I know there are 5-year strategic plans being developed. Just kind of paint me a picture of what cybersecurity and healthcare might look like over the next half decade.
Yeah, great question. We did put together in the cyber working group 430 organizations, 1,000 people, a 5-year strategic plan, 10 major end state goals, which is what we should be looking like in 29, 12 implementing objectives, the to-do list. And if we were to succeed as a national healthcare system in achieving those goals, I would say there would be 6 major pillars that we could look to as measures of success. The first is that the cybersecurity across the healthcare system, broadly speaking, is a habit. It is part of our daily business, part of our normal thinking. Just as we need to make money, we need to secure our systems. Number 2 is the technology and services that we use in the healthcare system. It's got to be secure by design, by default. That goes not just to the manufacturers, but to the users, secure by demand. Third is we need to have a workforce that is trained from the basic down to the frontline clinicians, all the way up to the CEO. We don't have that yet. Training still is lacking. Fourth is we need to have a system where the smalls aren't left behind. Right. The underserved are not. So we need to have a cyber safety net, as it were. And then number 5 is the culture of cybersecurity has to be driven from the top. CEOs on down, they have to own it. The boards of directors. I'm hearing more positive news that many CISOs, small and large, are getting airtime with their boards of directors, their boards of trustees. So there is interest there, and I think it is the urgency from ransomware. So C-suite on down, and finally, the last one I would call a 911 cyber civil defense, and that is what I talked about earlier was we don't yet have that instinctive, reflexive, always-on hive mentality as an industry, like a beehive or an ant colony, because they know how to take on intruders. We are more scattershot. So how do we build a system that on the front end is strong and meaningful and actionable information sharing, and on the back end, right of boom, after the cyber attack, how do we quickly, collaboratively respond, recover, and get our business continuity back on track? And that's a hard thing to do. It's a very hard thing to do. But to the extent, 911 cyber civil defense, we have those cyber fire departments. I said cyber corps before, but you have a community of first responders in cyber who understand that your vulnerability as a partner could be my cyber attack. So we're all in this together.